Hi everyone, it's Candace at Dr. Emer's office, and I'm here with our patient that is having a whole day's worth of treatment done. She came in with concerns with uneven skin tone, so I'm doing the COSMELAN peel on her. Before we did this, we prepped her skin with the salt facial. Salt facial is an exfoliating treatment that helps to clean the skin, exfoliate, remove excess dead skin, but it also helps increase the product penetration of our COSMELAN. So we always want to prep the skin before applying the peel. I always say it's like sanding down wood before you stain it. You get better penetration and the results are better. So this is our peel here. COSMELAN is a pigment inhibiting peel, and it works by suppressing pigment production. So there is an enzyme called tyrosinase. It's one of the key enzymes in forming pigment in the skin. And the ingredients in this peel help to block that so that one, pigment will not be formed, and two, will lighten and brighten the skin. And the way we lighten and brighten it is that we're increasing the cellular turnover rate of the skin. So as we suppress the pigment production, we're lifting the dead skin. So all of the dead cells are coming up, and in turn, they're flaking and coming off. So the surface appears lighter because we're getting rid of all of those dark, damaged skin cells. And as you can see, we're applying it pretty thick on the skin. It feels like a mask, so this part is actually kind of enjoyable. There's no sensation to this. It's not like a typical chemical peel where you usually feel a little bit of heat. This just basically feels like a mud mask. So for most people, there's not an issue with this. The only thing is that you have to keep it on for 8 hours. So our patient will leave with it on, and then for 2 weeks, she will follow a strict regimen of skincare. And the reason why it's a 2-week process is because we're delivering a maintenance cream to the skin every day, twice a day, for the whole course of the 2 weeks of the peel. So we're delivering a lower dose of this active ingredient that's in the peel every single day so that we get gradual shedding. It's unlike chemical peels that essentially just burn the skin and then the skin, dies and sloughs off. This is different. It's suppressing pigment and lifting dead skin. And this is safe for all skin types and tones. This was actually developed for Asian, Hispanic, African American darker skin tones, or skin tones that usually create more pigment. So safe for all skin types. Everyone looks better when you even out the skin tone and decrease pigmentation. There's studies that show that just evening out the skin tone and brightening the skin makes everyone look 12 years younger. And I love to tell people that because when you go into the Vizia machine before having these treatments, everybody always has a little bit of a shock if they haven't yet done any peels. Because typically everyone, especially here in Southern California, has some sort of pigment on the skin. So when you just get rid of that pigment, it automatically reduces your age. So that's one of my favorite things about this peel, is that just getting the skin clean and the surface brighter makes everyone look and feel younger. And that's always the goal. So we're getting an even application all over. This can go right under the eyes as well if someone is suffering from dark circles. It helps if the skin under that area is actually pigmented. But sometimes people have just genetic dark circles, or it could be the blood pooling there, casting a shadow. So there's a lot of reasons. She doesn't have the pigment from dark circles, but she has a little bit of hyperpigmentation from UV damage, so I'm going to try to get it up into that area. Do we have any questions on the live at all?
Yeah, can this be used for post-inflammatory hyperpigmentation?
Absolutely. In fact, one of my all-time favorite before and afters with this peel is from a patient that had really bad PIH from acne, and the results that she had were incredible. So yes, absolutely. This is a great peel for anyone who has PIH, sun damage, environmental damage, age spots. Melasma is huge. And the reason it's the gold standard for melasma is because this product doesn't generate heat in the skin like a normal chemical peel would. So a trigger for melasma is heat. So that's why a lot of people with melasma are told not to do hot yoga, not to be in areas that are super hot, maybe like a sauna or a steam room, because that can activate your melanocytes and create more melasma. So since this doesn't generate any heat in the skin, it makes it very safe for melasma patients to lighten the skin. And we always prep people, especially with darker skin tones, darker hair and eye color, with this peel before a laser or even a radiofrequency needling device like Fractora, because it's going to lessen the chance that someone would create post-inflammatory hyperpigmentation after doing a laser. So I always say it's the insurance policy that we're going to get a good result, and it obviously is only going to benefit the results and make everything more effective.
Would this work better before or after microneedling?
It just depends. Usually with the microneedlings, it depends on the treatment plan and what you're treating. We can do it either way, actually. It depends really on the case and the type of skin and what they're treating and their skin concerns are. So either way, it just depends really.
What is PIH exactly?
PIH stands for post-inflammatory hyperpigmentation. So if you have, say, a large cystic pimple, generally speaking, after the inflammation is gone and it's flushed with the skin and you don't see the bump anymore, most people are left with some sort of pigment, whether it be red or purple or brown. Everyone's skin tone will react differently, but 9 times out of 10 people get some sort of post-inflammatory mark after acne. It can even be after surgery, after a scratch or a scar. The skin just naturally in the healing process will leave a little bit of a pigment. So PIH is post-inflammatory hyperpigmentation, and this is a great treatment for that.
Can you do this at home?
You can do it at home under the supervision of one of our staff, so it has to be one of the aesthetics team or nurses. This is considered a prescription because it is a high strength, but if you are a patient with us, I can walk you through the steps virtually. So typically if somebody lives far away and they can't do it, they come visit us and they can't do it while they're here because they're on vacation or working or whatever, we'll send it home with them, and then you get to FaceTime me and I walk you through the process. So it can be done at home. It's, as you can see, pretty simple. It's like applying any face mask. Really the most important thing once you get an even good application is that you want to keep it on 8 hours. You want to avoid any sort of heat during this because you, A, don't want it to smudge. B, if you have melasma, you don't want to activate any heat in the skin. And then, doing the maintenance program, you got to be consistent with it. The peel isn't going to work if you don't apply your maintenance cream and follow the instructions. So it is very easy to follow, and everyone's they leave with their products and all of the instructions, and then from there you keep in touch. We track your progress, and then usually at the 2-week mark it's go time for lasers.
Does this work on stretch marks?
If the stretch marks are pigmented, yes. It's not going to help the texture because stretch marks are scars essentially, so it won't help the indentation or the texture of a stretch mark, but it will improve the color if your stretch marks are dark. And if you plan to have any sort of treatment on the stretch marks, then this is usually a good idea to prep with first, so that when we're doing the textural work on the stretch marks, you don't get any pigment.
Are there any health concerns with the hydroquinone?
That's a controversial topic. Hydroquinone is safe at certain doses and used properly. I think the biggest concern, obviously you want to be under the care of a physician if you're using hydroquinone, but for me, I think the biggest concern is the photosensitivity that can come along with it. So these treatments and the use of hydroquinone products are only appropriate if you're diligent with your sun protection. You absolutely must be on an antioxidant daily. You must be on a sunscreen daily. You have to reapply if you're going to be outside for extended amounts of time. And I always advocate the use of hats and sunglasses for anyone. It doesn't matter if you're just going outside for a 10-minute walk or if you're outside all day. You should be covering your skin. As a general rule of thumb, but especially if you're using any sort of these lightening and brightening ingredients, your skin needs the extra protection because you're going to have an adverse reaction if you're exposed to sun. So you got to play smart in the sun, and otherwise I find it to be very safe, but obviously for certain people, especially pregnant and nursing, you're going to avoid this right now. But other than that, it's up to your physician.
How can you tell the difference between melasma versus HP?
By and PIH, post-inflammatory hyperpigmentation, or just hyperpigmentation?
Just hyperpigmentation.
Oh, yeah. So hyperpigmentation can come in many forms. It can be the PIH that we spoke about. It can be incidental sun exposure, which can be little freckling, or it can be bigger patches. And melasma typically comes in large patches. For most women, it can come on the forehead, on the upper lip. This is where I have it, and a few patches on the cheeks. Typically, they refer to it as the pregnancy mask, or it can be like a butterfly effect on the face. So that's generally how you see it. If you go out into the sun and you come back out, even if you weren't exposed or in the heat, and you come back inside and you notice a lot of pigment developed, typically that will show that it's melasma. Because the hyperpigmentation from the sun doesn't just come automatically. It usually takes time for that to come up. And the pigment can live deep in the skin and then over time start to surface. Another way to know if it's melasma is if it's hormonal related. So birth control can bring this on, pregnancy can bring this on. So if you have, if you're newly starting on birth control and all of a sudden the pigment comes out of nowhere, that's a good sign. Obviously with pregnancy, that's a good sign, but it can come later in life too, and it can come even if you're not on birth control or not pregnant. So it's usually hormonal related. You'll see patches that come up. It's just a different look than normal pigment.
So this works for both melasma and hyperpigmentation?
It works for all hyperpigmentation, so it doesn't matter if it's UV, age-related, melasma, post-inflammatory. This is the gold standard for all pigment. We can use it anywhere on the body, so it doesn't matter if it's your face, your arms, hands. This is a great area to treat, especially as we age. The hands usually will come pigmented as we, age through. So yeah, anywhere we can use it, and it helps all pigment.
Those are all the questions.
Awesome. Thank you guys. Keep watching, and we'll show her results soon.